you're going to introduce yourself. You start. Okay. Hello. Hi. Welcome. My name is Mercy Chepto, a clinical psychologist, and I'm here with
Dr. Mercy, medical officer.
Yes. And today's topic is on the health of your relationship and the relationship of your health. So ideally, what does this mean? Your relationship has a capacity to either regulate you or dysregulate you. So is it healthy or unhealthy? And that's why we're going to have a look at it in a mental health perspective as well as in a health perspective. And that's why we have a psychologist over here and a doctor over here, right?
Yeah.
And so for starters, we understand how relationship is a key thing for connection, especially among human beings. And one of the things that you're going to understand is how healthy is your relationship. From a psychology perspective, we recognize that the capacity to which you're able to regulate yourself, that is emotionally regulate yourself, would be dependent on how well you engage with your partner, right? And how well it brings about stress moments. And with stress moments, it comes about the stress hormones and the capacity to which you feel pain so much. And so having a way in which you're able to regulate each other is a key starter and a key point. And these would look like differently in different aspects. And so having this in mind, maybe I would engage my doctor over here, how he feels, how stress plays a big role in terms of affecting our health.
All right, thank you, Mercy. Of course, welcome to the live, and we are two Mercies, so it's a double situation.
Yes.
So what we'll do today is we'll have a look at the health of your relationship. Is it healthy physically? What can you do together as a couple to make sure you go together, live a healthy lifestyle, and prevent most of these lifestyle disorders? And as you've said, stress. If you're stressed, usually we want to say stress is mental health, but stress has a physical effect on your physical body, your day-to-days. And of course, there's a stress hormone. It's called cortisol. It's actually when you're stressed out, it will be very high. And when it's very high, parts of your body will have to react. Your heart will beat twice as fast. You'll start sweating. Apart from that, even your things like your cycle will definitely be dysregulated. All these are effects of the cortisol hormone. So maybe we start with the mental bit first and see just how much our mind affects our body. And of course, in what relation to relationships, healthy versus unhealthy.
True. And so given that she has explained the biological aspect, you recognize that stress has a capacity to bring about symptoms of anxiety and sometimes even symptoms of depression, right? And this can cause strain to a couple's relationship. It could be symptoms coming from external environment, that is from work, right? It could be it comes from other relationship engagements, maybe with friends. And so we have to look at, as a couple, how do you help each other to ensure that if a partner is anxious or is depressed, how are we helping each other? Are we able to seek to enhance therapy-seeking habit to your partner such that these symptoms are not straining the relationship so much, given that your partner cannot be, again, your therapist or your doctor, right? You recognize that with stress, if there is no proper communication, this could lead to further conflict that you maybe would not know how to handle, right? And so understanding conflict resolution, even as you are navigating these stressful moments, is very key. Why do we talk about the stressful moments? Because apparently, Mercy, in psychology, we do have 4 areas that when we are stressed and communication is becoming a challenge, we experience. There is the criticism, there is the defensiveness, there is the aspect of developing contempt towards your partner, and sometimes just stonewalling. By this, I mean now you are starting to develop the silent treatments and communication is not effective. And these 4 things is very crucial in terms of affecting if you guys are going to break up or not. And so stress can amplify this more. And that's why if these are coming out more, then it can tell you how healthy are we handling it. Is it on a empathetic starting point, or is it now from the criticizing starting point that, oh, it's you who's the problem, it's you, and now it brings, when there's criticism, it enhances more the defensiveness. When there's defensiveness, it now leads to the contempt. You're now looking down upon this other partner, and when that happens, now stonewalling is what happens. And now the stonewalling is what we've said, the lack of now communication. You stop talking clearer to this partner, right?
Yeah.
So these are really crucial things, especially mental health wise. And if we look at management, definitely we are talking about, are you able to seek therapy with your partner? If you're recognizing this in your partner, that maybe they become critical or defensive when there's a stressful moment, or they're stonewalling, are you able to emphasize the need of just having a healthier perspective that is far from just you and your partner, a neutral perspective, which different people view this perspective again differently? Or what do you think about that, Mercy?
I think you mentioned something about contempt. And usually it's very common saying, oh, familiarity breeds contempt. I agree and also don't agree. I guess that if you're familiar to someone, you guys can easily talk about any and everything. So you know each other's weaknesses and each other's strength points. But that should not be able to breed contempt in you. And as you've mentioned, the relationship doesn't have to be the relationship with the partner. It can be relationship with yourself. It's probably something you're noticing in them, because it's probably you need to work on yourself first before you become a couple. Even talking about relationship, apart from the couple relationship, we have friendships that also culminates as a relationship. We have your relationship to your co-workers, your relationship to your actual work, your environment, your family. So as long as you've worked on yourself, there's a very big chance you'll want to work on growing yourself within the relationship and then growing each other, both emotionally and when you're mindful of others. So about the stonewalling bit, I think of, is it a trauma response, an emotional response? Because most of us do it. We just form a boundary and say, this is where I am, or you're not willing to accept your partner situation and just say, my mental health cannot handle it. What do you think about that?
Thank you so much. That's actually a very good point. And maybe if I could start from the first thing you've stated now to addressing this last one that you've stated, that I very much agree that even as you're looking on the health of your relationship, it first starts with the health that you have, the relationship that you have with yourself. That sometimes even the safety net that you're looking for within your partner, for you to say that this relationship is now healthy, it has a lot to deal with how safe do you first feel within yourself. Because you'll be expecting your partner to be the one bringing the healthier version, and when just a small things happen, this person is not healthy for me.
Exactly.
I think I need to end it. But it has to do with more also in terms of what is healthy to you, for you to actually bring that in this healthy relationship perspective. So I much agree with that. And on the other aspect, when you say about, is it more of
a trauma response, or it's just it's an okay thing to do? Is it okay to stonewall and say, this is where my boundary is? Is it healthy? Is it unhealthy?
Okay, so that's really, really important. Recognize that, again, our responses to life and how we handle things majorly comes from our experiences most of the times, and our first exposure to life, right? So then what do I mean by that? I mean that it could possibly come from while growing up, or the environment that you're in. How was conflict being handled? Were people just, saying things to each other in a rude manner, and then it was never addressed, so it just ends up there? Or were there conflict and people would argue, and then later on you'll see them sitting down? Or in your circumstance, You never witnessed conflict because maybe your parents would handle it at a different setting, just so that they're not exposing you to that. So you find different people would navigate this differently because of their exposure. That if you had any of these three instances, you would be able to either approach it as there. Maybe you will not be handling it in front of people because you never saw your parents handling it in that manner. Maybe you will be silent treating after that because you recognize that people would conflict and then they never solved it. So it means they retreated and so it was never solved. Or maybe you saw it happening and then there was an amendment. So this really has to do about your first exposure. But as an adult, I feel most of the times you don't have to always say, because I was exposed to this, I always have to handle it as that. Now that is a trauma response, that you are acting upon it. It's okay to have a self-awareness, right? And take accountability, because self-awareness doesn't end up there. There has to be self-awareness, but there also have to be an accountability that what am I doing to also change the dynamics of me shifting from the unhealthy dynamics to now the healthy dynamics. I don't know if what do you feel about that?
Makes sense, but now how will I know it's unhealthy? Because I keep on telling myself, this is what I know. There's absolutely nothing wrong with stonewalling. There's absolutely nothing wrong with throwing my mental health can't handle this situation in a sentence to sound more intellectual, you know? So I think it's a trauma response, but I also think it's what has been normalized. Like we can't seem to be on the same page, then my cop out is my mental health. Or we can't seem to agree, I feel like I am right and you're wrong. That need to always say, you know what, I don't see the point of arguing, my mental health is more important. I sort of feel like it's a cop out, but also a trauma response.
Okay, and I agree with that it could be a trauma response, and sometimes we have to also know what is healthy and unhealthy. It can be hard to distinguish because if you're used to that, then you might as well just want to function like that because that to you is healthy. So to have a neutral perspective, it's okay sometimes if you're recognizing that these are causing strains in your relationship. A couple therapy is an alternative. Can we seek a neutral opinion who can bring us to the same page, given that our upbringing are so different and the way you're viewing conflict makes sense to you because that's what you are exposed to. How I handle it makes sense to me because it's how I've been wired to do it. And so that you aren't feeling like I'm saying you are the problem. It's okay to have a neutral perspective who can then guide us to have healthier ways. And so healthier ways varies from one person to another, depending with the need of their relationship. It could be as simple as navigating communication, right? That when there's a problem, if both of you are avoidant, you'd be avoiding resolving it because you feel like
say I have an avoidant personality.
Okay, an avoidant attachment style. If you are more of an anxious person, how would you approach that? An anxious person is that person who wants to always address things there and there.
Then as they happen.
Yes, because
as opposed to people who want to address it 3 weeks from now.
An avoidant, right? Because an anxious one would feel like they are having so much tension within themselves. They are not well rested within their body. And so that already will tell you that it's not healthy how I'm handling because my body is reacting. And so it goes back to the health, how your body responds. If it feels uncomfortable, then definitely it's not healthy, Mercy.
Yeah.
Right?
Yeah. What's your feeling about somebody can say this is my type of person, or rather the attachment style? Does it have any correlation to what we seek in relationships, in friendships, in intimate relationships? Does a person's attachment style sort of dictate their type?
Okay, so by attachment style, you mean the way in which we engage with people based on our upbringing. For someone who doesn't know, that is what an attachment style is. And yes, we do have 3 different kinds of attachment style. We have the secure one, and we have the anxious, preoccupied one. We have the fearful avoidant, or we have 4, and the dismissive avoidant one, right? So in terms of how you choose a partner, most of the time we choose based on what we feel we are lacking. If I want someone who reassures me because maybe I never got that, I'll try so much to get that in my partner. And chances are high, I will be anxious preoccupied, because people who are anxious preoccupied are the ones who crave validation, the need of being reassured from time to time, the need of feeling like you need to ensure that you are here with me. Can I get that reassurance?
Yeah.
If you don't do that, I become...
Words of affirmation.
Yes, I become anxious, and I feel like then you aren't tending to my needs, right? And you find most of the time, these people attract avoidance. Because...
It's like opposites attract.
Yes.
Can I just attract somebody who isn't avoidant?
Because a fearful avoidant, it's not that they don't want intimacy. Intimacy is good, but because of how it comes with intensity, understanding how emotions comes with intensity, it may feel overwhelming. And so why do they take time to retrieve so that they can come back to talk to you? And that would appear like maybe you're ghosting, or you're taking time, you're losing interest.
Yes, the anxious person would say, why would you stay with something for a week or two? Like, can't you just address it? Aren't you feeling like it's holding you back?
Yes. But for this fearful avoidant, remember the way they are operating, it's different. To them, it makes sense. They don't know any other way to regulate themselves, but to take a moment to actually not think about what is happening. So during that phase, they would not want to engage with people. And so when they come back, an anxious preoccupied already is frustrated at that point. And so maybe they've tried to put more energy to reach out to even understand, why are you ghosting me, and that. And so it is important for us to recognize these dynamics so that we are able to address them in therapy, even as a couple, because you recognize even in couple therapy, sometimes you will be encouraged to have an individual session, because the couple therapy is to help the both of you navigate the challenge at hand. But the individual one is now to navigate the insecurities you're having based on how you're living life.
Okay.
Yes.
Thank you. So I think I'd like us to take a small detour on the physical bit. I know right now we have this sort of obsession with living healthy, what diet is the best one, what lifestyle is the best. And you feel like maybe you're having a partner, and then somebody will tell you need to lose weight, and then comes in the normal sayings of not all plus sized people are actually unhealthy. Thin doesn't mean healthy. And people are disqualifying a lot of medical data out there. So when you're in a relationship and you feel like you need to take that health journey, this is usually in January when people say, new year, new me. I am joining the gym. I am doing this. It is actually going to be easier to do it together. If you're both working couples, or if one of you is working, the other one isn't working, or you both have different lifestyles, one thing that brings you together is the food you eat, is how you sleep, how you, apart from food, eat, sleep, how you exercise. Because if both of you have come together and said, you know what, we want to do a gym membership together. When are we going to be going to the gym? You said, no, we are both free from 6 p.m. to 7 p.m. Let's make it a bonding moment. Let it not be one person is on a diet, the other one is eating like fries. At that point, one is on fries, pizza, burgers. The other person is on healthy, boiled food, steamed food. But then the other person, at one point, one will fall into the cycle of the other. It's not necessarily the healthier person will influence the unhealthy, but probably the other way around. So it's easier if you do these things as a couple. It's even easier. People have working groups. It's easier to do it in a group. In other words, if you have company in your journey, it makes your life very easy. And talking about being healthy, it's the beginning of the year. It's usually easier, or the best thing to do is have a wellness check. Or if you do one at the end of the year, it needs to inform you next year. So a wellness check isn't really you looking for something wrong. You're just wanting to know, where is my starting point? Of course, we're screening for disorders like cancers, we're screening for diabetes, we're even screening for hypertension using BP measurements, we're screening for kidney disease. the earlier you know, the better. A few years ago, we were all concerned about infectious disorders. Right now, I promise you now, into the next 10 to 30 years, we'll be talking about lifestyle disorders. We'll be talking about how 20-something-year-olds have type 2 diabetes, how teenagers have diabetes that used to be an old person disease, why a 20-year-old is having a heart problem, yet we know heart failure is a 70, 80-year-old. So screening, your wellness tests, these are very essential. You make it part of your daily life. Then you know, today I'm starting at point A, I need to be, my cholesterol needs to be at point B. How am I going to work with this? Trust me, if you have company, it really works. If you don't have company in it, it will feel so lonely, because most of the time, the ladies tend to be the chefs of the family. So imagine having to prepare your own meal and prepare the family meal. So if you have your family walking the journey with you, it's very easy. Yes, something about that.
And I really like that aspect, especially on lifestyle habits. And I do wonder how, if maybe a couple would want to do this and they're helping each other, how often can one decide to actually take part of this? How often?
All right. So let's say, for example, you and your partner decide you want to know where we are right now. Of course, lifestyle disorders, cancer has become one of the lifestyle disorders that's non-communicable. Of course, there are risk factors here and there. Like I've seen couples on social media doing like dry January, dry February. They're trying to get each other to actually stop taking alcohol. Or like a sobriety journey. You see somebody try, me and my husband or my wife and I are trying dry January. And then they go the whole of January, and then they say we're trying dry February. It's just take one habit. If both of you aren't sleeping well, try screens are done at what time, coffee is ending at what time. And then you say, today we'll sleep from 10 p.m. to 5 a.m. Tomorrow we'll try 10 p.m. to 6 a.m. So not really codependent on each other, really, but you're working towards a goal. So you come here and you do tests.
The test.
For example, the ladies, you have to do pap smear. January was cervical cancer month, because cervical cancer is one of the preventable cancers right now. It is the cancer that has a vaccine. It is the cancer, actually, I think this month, there was a conference of gynecologists, and they're now actually suggesting, rather there's data that has said every woman under 45 years old needs to be vaccinated. There is a vaccine for that. Usually we'd say under 10 years, girls under 10, but now there's a vaccine of up to 45 years. This vaccine is actually very helpful. So imagine telling your partner, I need you to get vaccinated. You would have saved a life. Doing something together is always better than doing it on your own. Talking about wellnesses, you come and you tell you your blood pressure is slightly borderline. Most of these lifestyle disorders, you don't have to wake up today and get it. It's usually a gradual situation. Like you come today, I tell you your blood pressure is at 130/80. And then the new guidelines are saying 130 to 139 is high normal. It means at risk. A few years ago, 140 was at risk. But as studies show, as we go, our lifestyle is different than our parents and our grandparents' lifestyles. And also with the urban population, we don't walk, we don't run. We take Ubers, we take Bodas, we take Matatus everywhere. We do not have the walking distance from here to the stage, from here to where. So about screening, for the ladies, whenever you do any wellness test, please ensure you include a pap smear or a HPV test. It goes a long way. We'll screen for diabetes and tell you, you know what, your body isn't really handling sugars as it should. Do you have a family history of diabetes? Yes or no? How is your lifestyle? Are you working out? How are you putting? Are you having a lot of processed sugars? Are you having a lot of processed snacks? Like in the office, 8 to 5ers, we usually just like crisps. We're having we're having some chocolate. It's very processed. So in that wellness isn't just about the test. It's about the whole human being. We'll talk about for men, we'll talk about the prostate issues. We screen for prostate issues because prostate cancer is also one of the preventable, because it don't just wake up today and realize you have cancer? No. And something interesting is also something about gastritis and heartburn. Your stress level can actually give you a heartburn. The heartburn is the symptom, but it's usually stress-related gastritis. But you see, over time, gastritis can actually lead you to stomach cancer. So your body needs you to be wholesome and holistic. So when you come for wellness, when you do the tests, when you have a doctor's consultation, of course, maybe you probably just have a cold and you're like, no, I need to be tested. We'll do a full panel for you. We'll tell you, you know what? I think we need to have a look at your blood pressures. I think something is off about this kidney, because sometimes you have kidney issues and don't even have symptoms. You have high blood pressure and don't have symptoms. So you didn't know, like when you have a cold and you're sniffling and all the time, that is very easy to know. But if you have hypertension and you don't have symptoms, how would you know you are at risk? You wouldn't. So you're screening yourself. And also, can you tell us something about mental health screening? There's a lot of stigma around that.
True, and that's true. And I hope you're following. And in case you have any questions, kindly drop it so that we are able to also address it and ensure that you aren't just going without being addressed that which is burning. So, and I really like what you've talked about, because when you look at it, I agree that our lifestyle habits affects most of us, and your partner's habit has a capacity to influence you as a person, right? So in the event you have a partner who really likes to ensure that they're doing the checkups, this could also influence the other partner, right? But you have to recognize how supportive is your partner, because recognize, even as we are talking about lifestyle habits, if someone is on the extreme end and they're so cautious, and maybe your partner has added weight, how does this partner goes about such that it's not affecting the other partner's psychological status? You know, it is easier to say, like, let's build a gym life habit because we are taking care of our body, our weight, looking at what you've just stated right now. And it's another thing for one to criticize that there's something you need to do about.
Exactly, you're no longer as agile as you are.
So a supportive partner plays a big role in as much as we are talking about good lifestyle habits. It also is crucial to recognize the kind of partner you're having. Because the same way this is a good thing, it's the same way you can also develop a substance use disorder because your partner always frequently uses. It's the same way that if you want to have the sleeping pattern that you're saying, your partner can impact it if they disagree with that. So psychologically, lifestyle is a key thing that you also get affected based on how your partner is receptive towards it and if it's a goal or a value that they share. So having aligned values and goals will play a key role to reduce the psychological stresses that comes about with you always having to say why this is important. And so that goes to the beginning of it all. Do people recognize if they are aligning, their values are aligning in goals such that, again, you aren't going to say that, oh, this is so maybe new to me. I didn't know this person wouldn't want therapy. I didn't know this person wouldn't be someone who really cares about my health. Because remember, with the chronic diseases, unfortunately, when you screen people, I'm guessing that those who rate it
higher than others, because we usually have something we say pre-diabetes, pre-hypertension, though right now the correct term is a high normal. There are some levels too. For example, if you have 130 to 139 as your systolic BP, the upper one, I'll say this is a high normal and let's do something about it. Is it your stress level? Are you eating too much salt? Are you not working out? You see, there's a level we can prevent and not actually put in medication. But there's a level that when we get medication directly. And remember, there's also the psychological bit of pill burden. If you can prevent it, it's easier. Prevention is always better than cure, right? Yeah.
True. And so it requires not only support physically, but also, do you guys normally say that because we've recognized this is you're having, psychologists would be at a better position to maybe help you adjust to the acceptance of this is my new reality?
Yes. Sometimes you tell somebody, you know what, I think you're diabetic. I think these symptoms you're having, kuna shida ya sukari, you know, and they'll give you a whole list of reasons why they don't. They'll give you a lot of reasons why their blood pressure is at 180. Yet you're telling them there is no other way. You just have to lower it. Then they'll give you like a whole reason. I went to Google. Google said this. I can actually control it using garlic and that. We're not disputing your Google search, or rather, we're not disputing your body. We're just telling you that your mind needs to catch up. Hence, a referral to a psychologist or a psychiatrist, just to get them to the acceptance. You know, it's like the 5 stages of grief. The same way 5 stages of a diagnosis of a chronic disorder. You have to get them to acceptance, and the easiest and the simplest way is usually to have them see a psychologist.
Okay, and that's very accurate. And now that we've talked about that, I think it's also important to recognize how the relationship of your health plays a big role in terms of how it affects a relationship. Because if someone has, maybe on a mental health capacity, has developed anxiety or depression, this has a capacity to either make one become more hypervigilant or sensitive to rejection, right? Or sensitive to any slight changes because it's overwhelming, right? Same case, if someone has developed a lifestyle disease based on how they've worked so hard at work, and maybe they've reached burnout stage, this would make them withdraw, right? And so psychologically, this will send a signal to the other partner that there's something I'm doing wrong. Maybe interest has shifted. And so your health plays a big role in terms of how this relationship will stay at the end of it all. Not only that, in what has come, okay? It could be we are navigating a chronic condition, but together. Okay, that I'm recognizing what has the side effect. I'm taking an initiative. That's why a supportive partner comes in hand, right? I'm taking an initiative to know how these symptoms has a capacity to affect your mental health status. That because I'm losing my functionality, I have to get more support. I would want you to understand me more, that I'm not able to do this task immediately because it takes more time for me to adjust. So I really do agree that in as much as we're talking about the lifestyle habits, we also have to merge it at the end of it all with the psychology aspect of it. And so that comes in at the end of it all. Therapy is important on an individual level and also on a couple level, because what points do we then seek this couple therapy? We seek it when we are navigating such as a new diagnosis, right? And we are a couple, a new diagnosis. Maybe there has been a miscarriage that has just occurred. Maybe there's some financial shift which is so major, instead of now the stonewalling that we're talking about. It's okay to address them such that it's not leading to other health challenges that are going unnoticed, right? If there is a new season, motherhood comes with it all. And sometimes maybe some mothers feel like my partner does not understand how this is heavy for me. And so even at this point, it's okay to have a couples therapy to help with the new transitions of life. There's death of a child or a loved one. How do we navigate that? Do we blame each other, especially for child? I know this is a case that it has a capacity to break couples, because there's always just as you stated, the grief stages. We have different stages, and many couples would stay on the bargaining and on the just blaming each other. So recognizing when to seek help comes in handy, because we could talk all about how seeking help is important, but if you really do not know which times you are to seek help, then it wouldn't come in handy. And which times do we seek help? On a psychological capacity, if couples are just normally functioning and they feel like I'm at a good space, it's okay to just have a check-in once or twice a year, right? But in the event there's something happening, as such as I've listed, maybe the losses or the major shifts, you don't have to wait once or twice a year. You have to seek it as early
immediately,
as that, right? because that the earlier you seek it, the better the management. Because unfortunately, people take seeking therapy as the last
The
resort.
last resort, like this is what is going to save this relationship. If it doesn't, then we call it quits.
Yes, but the moment you recognize there are changes in terms of how maybe you're functioning initially, that is an indicator that, you know, maybe this is the right time to actually seek help. We don't have to wait until things get worse, right? So I really do agree. What do you think about what I'm passing across in regard to that?
I do hear you. At sometimes I feel like for couples or for individuals, therapy seems to be they're looking for the wonder drug, the solution. We tend to not want to go to therapy. Oh, of course, the stigma around therapy, but we've turned our family and our friends into our therapists, yet they are not professionally situated to deal with our issues. Like you want to call them and vent for 1 hour. I'm like, no, how about you call a professional and vent for 1 hour and come up with a solution? Not, you go girl, you have it done. You are right, they are wrong. It doesn't have to be. I always say life isn't white or black. Just pick your shade of gray and go along with it. So I think couples or even individuals should normalize therapy. Like the same way you have a headache, you go for paracetamol. Let's not treat headache like the solution. Rather, therapy like the solution. The same way if you have a headache, you go for paracetamol. What if the paracetamol does not work? Something deeper is going on. Maybe you're having an infection or something. So if you keep taking paracetamol for the infection, it won't help. You need an antibiotic, an antifungal, an antiviral. So I think we should treat therapy like a daily life. You're about to get married. How about have premarital counseling? You're thinking of getting a child. How about have that pre-major event? Let's not wait for the major event to give us the kushtuka. It is
The
here.
indicator.
What is happening? Like the baby is now here. We've been struggling to get pregnant. Now I'm 9 months in. I don't know. I'm anxious. Probably your partner is as anxious as you are. You all need the neutral person to bring you back to 50. You can't be functioning as a handler all the time. You'll get a lot of lifestyle disorders. And just think of therapy before the big life change. Some life changes are not predictable, but when they happen, find some help.
True, I agree. So again, this means it boils down to curbing stigma towards couples therapy and just generally therapy, because recognize there are those who don't embrace it because they feel like if you're suggesting it, then this means
something is wrong.
Yes.
I am probably mad or something.
Yes. Or we are not able, does that mean we're not able to function as an individual?
Exactly. When somebody say these misnomers that probably a psycho, I'm like, no, psycho could mean psychotherapy. I mean, yeah.
True. So that's very true. So this means that if you having maybe a partner who resists to, you know, having therapy, how would you navigate that? Because that's a key thing, because we all have different perspectives. You have to recognize that a key thing, and I really agree with what you're saying, Mercy, that a key thing is to not make it as you are the problem when you are refusing it. Okay? It could be that the experiences I've had is making me feel like, no, I think there are other ways. So addressing it, having a common goal as to why we need therapy is important. And sometimes it could just be put outside there for a trial. We can just try once or two and see how these would turn out for us. So it doesn't necessarily have to be like we are seeking it because you are the one who led us to this conflicting. Well, unfortunately, in some circumstances with infidelity, you find that one party would feel like they're the one on the spot.
Exactly, and the partner on the spot would want to say, "You probably led me to do this." You know, it becomes like a whole situation when it should have been resolved prior to that.
True, but in real sense, recognize what therapy is trying to do is to bridge that gap. That if you've chosen to take another shot towards ourselves, can we do it on a neutral stance, such that I don't feel compromised or I don't feel like I'm at a situation where I have to compromise so much because maybe I did this, yet I want us to mend it. So a neutral perspective from a couples therapist would help two people be able to have a conflict resolution strategy, be able to know how healthy the relationship is and where they stand. But at the end of it all, the decision making is always on the couples. No therapist would ever tell you, now, because you guys have come to this, it's high time you just separate. That decision is always solely on a couple based on how they've experienced the therapy and how the kind of enlightenment it has brought to them. So therapy is not about
putting blame.
Yes, or tearing people. It's not about putting blame or tearing people apart, but more of trying to bring people together. Despite our different personalities, can we make it healthy for ourselves?
So I think I have a question.
It's okay.
Talking about therapy, and what if my partner and I come to therapy and they are the one who have had a disgression or something. They have digressed from the relationship. And in the process of being in therapy, the two of us, we learn some new things about each other and we decide to separate. Isn't the partner or one of the person who feels aggrieved would say therapy was the reason we separated? Is there a way you can go around that, about that? Sorry.
Okay. I've had you say something that while they're exploring, they came to a consensus that this relationship is not working for us. And so we'd rather...
Like the self-awareness.
Yes, we'd rather go our separate ways. If they've agreed going towards their separate ways, then this means it's what they feel is beneficial for them. Unless one party was not honest enough to say that.
Yeah, sometimes that may happen.
Yes. So it has to be that they've agreed upon, because you can't say I'm leaving and maybe they don't want. But in the event one person wants to leave and the other one doesn't want to leave, now that is on a different level. You see that in that part, an individual therapy would come in handy to help this person address the things that they're feeling. Maybe they're being put blame on, okay? Because remember, already the couple therapy session has done its job. It has helped you guys reach a consensus. So if there's a further adjustment that you as the couple would want, or the separating couple would want, it means that it's okay for you to seek an individual session so that you are adjusting to this, okay? The lady, the man, or whichever, the partner that is involved in the separation, so that you don't feel like you're going with so much mixed emotion. But again, I agree with you. There are those who would end up saying it's not working because maybe they didn't get what they wanted at the end of it all.
Okay. So I think we'll take some questions, just a pause for some questions.
If there are any questions, feel free to drop in so that we're able to address you up to there.
Someone is asking, can emotional strain in a relationship affect physical health?
So thank you for your question. The question is, can emotional strain in a relationship affect your physical health? Definitely. Because when you look at wellness, we don't just think of disease. Emotional strain and emotional stress, all these things are stressors, whether it's emotional or physical. So if you're stressed out, your body is going to be on two situations. Number one, your cortisol levels are going to be very high. When you have high cortisol levels, first of all, you'll overeat, you'll gain weight, your brain won't function normally. You won't be able to concentrate because your body is working in a stressful situation. Your adrenaline levels are constantly high because you're like fight or flight. It won't limit you to the time you're together with that person. It will pour over to other parts of your life. You'll start getting physical symptoms of anxiety. You'll start having difficulty concentrating. Your heartbeat will be beating very fast. And remember, stress can actually lead to hypertension. Your blood pressure will skyrocket. You get hypertension. We now actually have to worry about your kidneys, your daily health. Some people, when they get stressed out, they have migraines. All these things are physical manifestations of emotional stress. Because we want to say, I'm just a little bit stressed. Something is off about the relationship. But if something is off for 6 months in a row, imagine your heart beating 120 beats a minute for 6 months. Of course, it's going to get tired. Of course, it will be enlarged. And suddenly we are talking of issues with cardiomegaly. Your heart is too large. Your heart is failing. You're having hypertension. We have to reduce your blood pressure. 1 minute, your cortisol levels are so high. You start gaining weight in this disproportional manner. Means your body is not using up the fat or the whatever you're taking as it should. Emotional strain will also have you eating unhealthily, because people will say, I like eating my feelings. In the real sense is, you're eating your feelings, yes, but is it healthy? You're eating processed food. You're eating too much starch. You're not thinking about the protein. Your body needs protein. All the nails, your hair, those are just protein. Some people, when they get stressed out, they want to bite their nails. They find difficulty even concentrating. And it's not that your body is not able to do it, just that the hormone you told your body to release is the problem. Because you are the one who signaled your body, when we are in battle. No other person has signaled your body. No, it was the emotional strain that you are that you were experiencing in that relationship that told your body it's time to fight. And then your body will flood you with unnecessary hormones in that moment. Yeah. So definitely affect your physical health.
Which are there health screenings that couples should consider doing together?
Yes, of course, the question is, are there screenings you can consider doing together? Definitely. One, we have the basic tests, the hematology, like full hemogram. It's a complete blood count. You're looking at your white blood cells, red blood cells, and your platelets. Of course, both of you can take cholesterol tests to know where you are, because cholesterol is like a direct reflection of your heart health. Apart from that, you can talk about you want to have a look at your urine. Some people even prefer to have a sexual screen. It's a sexual and reproductive health screen. Like, you're thinking of starting a new relationship, and of course we all don't know each other's pasts. In that moment, just give us a call and think of, I want to do a sexual screen test with my partner. Very private. Nobody will get to know. The results will be shared with you individually. If you decide to discuss with your partner, well and good. So we can do sexual screen. Of course, this is usually people beginning a relationship. That is somebody who cares about their well-being. Number two, we can do different packages. They're nearly similar, except for the place where for men, we're checking for prostate issues, and for ladies, we're checking for cervical cancer. And doing a pap smear doesn't necessarily mean you're looking for cervical cancer. Remember, cancer doesn't wake up today and become cancer. It changes that are gradual. So if we catch it at the point of just an inflammation, you have a better chance of surviving. Also for the ladies, we want to talk about breast cancer. For the men, of course, prostate. For both of us, we'll do colon cancer. There are so many tests, and they're not even invasive. So definitely, it's a good thing to do the screening test with your partner, and HealthX has several packages that are designed and fit you, depending on what you can do. If you have insurance, remember, most insurances actually do cover for this.
Is therapy only for couples in crisis, or when should we start?
Okay, the question is therapy only for crisis, or when should we start? Okay, so basically therapy is not just for crisis. Sometimes people do seek therapy when they're just good in life. They just want to navigate the big joy that they're having. Maybe they want to now settle down. That's a good moment. It's not necessarily a crisis. You've gotten a promotion and you want to adjust to that. It's not a crisis. It's a good thing, and you'd want to know how to handle this best. So, and sometimes it could just come from a point of self-awareness. I have an interest of understanding more about myself and understand what's maybe hindering me from achieving some things, or what kind of person am I? Am I healthy for myself or not healthy? So seeking it is based of how important do you see it, right? Because it's an important key aspect in terms of self-evaluation. However, if there is a crisis, definitely seeking it immediately is a priority instead of waiting. Why am I saying this? Because most of the time, the intensity of care varies. And we look at that based on your functionality. If maybe someone is coming with symptoms that are mild or moderate or severe, all this requires different kinds of therapy intensity. And sometimes it comes with a combination of medication, depending with what one is presenting with. So to summarize on that, you don't necessarily need to seek therapy only when you are in a crisis. You can also seek it when something good is happening and you don't know how to handle that, or there's just a transition and you'd want to ensure that you're handling it well. Yeah.
What are the signs that a couple may need therapy?
Okay. The question is, what are the signs that a couple may need therapy? So these signs will vary from one person to another based on what is pressing at hand. A couple would maybe feel they need therapy because at this point they're having a strained relationship because communication is low. They don't know how to navigate the conflict that is at hand, despite trying their own way of resolving that conflict. Because remember, we resolve conflict based on what we think would work. And sometimes that doesn't really help us, right? So another indicator that a couple need to, again, seek therapy would look like if there is a withdrawal, that maybe now we are not as intimate as we would, or we don't share the interest that we would because one person is isolating or is sort of taking a distance from the other. Okay, so these are some of the instances whereby a couple therapy may benefit from seeking a therapy, but also they may seek if they're having adjustment challenges. As a newly married, you've just gotten married and all of a sudden it becomes the honeymoon phase fades, and now the reality is that I'm with this person and it's now maybe becoming a problem. It's okay to seek therapy so that you're adjusting and you're not drifting away or doing things that is harming the relationship. Yeah.
How do I encourage a partner who doesn't like hospitals?
Okay. How would you encourage a partner who doesn't like hospitals to take up our screening or our wellness package? First of all, HealthX is a telemedicine company, so if you come visit us, we just seem like a normal office. Number two, you can just call us via the phone and we'll pick the sample from your office or from your work, or from home or from your workplace. Or we can send a phlebotomist to your location all over the country. They pick the samples, send them in, we give you a call. And if we deem the need for a physical examination, if you're in Nairobi, we can ask you to come to our offices. So it's not about liking or not liking hospitals. There are ways you can go through that. Remember, there are mobile phlebotomists. We can call you from the comfort of your home. You don't necessarily have to come to a hospital.
What habits can couples adapt for better health together?
Okay, so now that's more like the 5-point wellness. Your diet. Think of less processed foods, more whole foods. So you can come up with a meal plan together. You can prepare meals, prepare lunches. You guys carry lunch for the office, meaning you guys have the same thing together. Number two, substance use. You can think of saying, this year, we went to run dry for 6 months. Your body will be very grateful. And if you're there 6 months later together, if you guys like going out every Friday, you can now decide to go to establishments that don't sell alcohol. You go to establishments that are actually fun to be in. And when you're together, so substance use, you can reduce on that. Exercise, 30 minutes a day, 5 days a week. You can do that together. You can walk, you can run. Even as you walk together, you can discuss issues you think you need to. It can be like a bonding moment. Sleep. If you guys live together, you can think of a sleep routine. You know, we'll tell you don't take coffee past 4 p.m., use darker curtains, don't take a glass of milk, you know. So when you're with somebody in that, so you talk about your sleep patterns. If you become too anxious to the point you can't sleep, that's a whole situation. So sleep, diet, exercise, and of course, stress management. You can help each other manage the stress. You know, like Mercy would tell you, if you're having long walks, long walks are really good for your mental health. Imagine having long walks with your partner. You guys are talking, you see something funny on the road and start even laughing and enjoying it. Yeah. So it's all about the wellness situation.
And I agree, because it also applies psychologically, how it helps you, that if you're having moments where you're talking with your partner, it creates moments where you are bonding, even when you've had a stressful moment, that each day you've scheduled a 15 minutes time where it's compulsory, we just talk.
Check in with each other.
Yes, checking in with each other. Same case when we say we are having routines that are helping us decompress because we have been having stressful moments. The exercise routine that you're talking about comes in very handy. Same case to the long walks that you're talking about. It comes in very handy in terms of boosting the satisfaction within the relationship, because psychologically you have to also be satisfied within the relationship. So these activities, doing it together, also boost a person's mental health capacity. Yeah.
So, what one message?
Do you start with you? Or rather, you can start with me. So what's the one message you can take away from this? Couples who screen, or rather couples who screen themselves together, stay together for longer. Or couples who make their physical health a part of the discussion, stay together for longer. See, we all want the forever. I know right now it's forever till we end, but we all want the forever.
Okay. And I believe that couples who are intentional about taking care of their mental health as couples within the relationship have more satisfaction within their relationship dynamics. So that is what I would say, because you have a capacity to either regulate your partner's nervous system in a healthy manner, or dysregulate it. So that's why couples therapy comes in handy to help you stay healthy. Yeah.
All right. Thank you so much for joining our live, and we hope to see you next week. Same time, same place.
Thank you.